During 2014, the leadership of the Metrolina State Medical Assistance Team felt it was important to step back and reassess the pulse of the team, and then embark on some important changes to the program. This resulted in some incredible momentum that carried us over into 2015. And this momentum created one of the most engaged years for the Metrolina SMAT that we have ever had, with volunteers participating in at least 10 events or deployments, not to mention their constant presence around the warehouse supporting the program as a whole. But before we talk about the events and deployments, we should talk about the changes in process we continued to make that were designed to continue to strengthen your team. We continued to maintain and solidify the structure and use of our active, reserve, provider, and orientation groups. This allowed us to tailor our messaging to the appropriate group based on the needs of the situation. Another important part of continuing to grow was to sit down and meet with the team veterans on an individual basis at the beginning of the year. We needed to know what their original motivation for joining the team was. Is that still their motivation? And are we meeting their expectations? This also gave us a chance to set our expectations moving forward. We also used this time to get suggestions about how to continue to improve the team. We also solidified the new orientation process that we had started testing in late 2014. With the success we had experienced with the one-on-one veteran meetings, we made a similar meeting a critical part of the new member orientation process. In fact, of the 12 potential new members who sat down to meet with us, 9 of them successfully completed orientation and have become highly engaged members of the team. Additionally, we began implementing improved ways to share information with you ahead of potential deployments. First, we increased the use of social media to share important team status updates. Second, we updated the SMAT Tools and Information page of the Metrolina Preparedness website to include reminders on mission types, packing lists, and the volunteer deployment checklist. We also began using the SMAT Secure page of the website to provide you with status and situational updates that we couldn't post publicly. Many of you also became more engaged by participating in special project groups we have been working to establish. First, the education group helped to create a roadmap of educational topics for monthly meetings and gave some important feedback on some other potential education and training ideas. Second, the supply unit was instrumental in implementing our new inventory rotation process. They worked hard to learn the online inventory management program, entered and put away new medical supplies, audited the restock totes, and helped rotate supplies. They also helped us update the inventory of the 37 tri-wall containers that hold shelter supplies. Any volunteer that has helped with inventory this past year made a significant contribution to the team and the region. As I mentioned before, the volunteers of Metrolina SMAT also spent a lot of time assisting and supporting the team and region with local events. January and February brought some winter weather to the region, and the volunteers helped with the deployment and return to service of cots used by local hospitals to help house their staff. In May, the team spent many long hours helping to support Cabarrus EMS with their response to the Spring Race Series, which covered 2 weekends. This was a great partnership between Cabarrus EMS and the Metrolina team, as well as with the Triad SMAT. In June, the Metrolina SMAT deployed a medical support unit and the M8 to the Western North Carolina Disaster Preparedness Region exercise. The team set up both units, gave tours, and had the chance to see other disaster response resources from around Western North Carolina. For July, team members participated in what has become an annual event for us, and probably one of our most rewarding. They helped provide underprivileged children with the necessary physical exams to start school or to participate in sports. During August, team members from the Metrolina and Triad SMATs participated in training to learn how to triage flu patients over the phone in case of a major flu pandemic. In September, they participated in an exercise where they put this training to functional use. This training and exercise was completed in partnership with the local Carolinas Poison Center and was conducted by the Centers for Disease Control and Prevention. Of note, the Carolinas Poison Center was the only participant to train and use volunteers in this exercise. Central Piedmont Community College was also instrumental in helping to provide the training in an online format. October was a busy month. Late in the month, the team helped staff the 6th annual Honor the Warriors ride. They provided communication and coordination for the route and staffed rider aid stations along the course. However, October did not start out very easily. We spent the end of September and the first 5 days of October preparing for the impact and potential flooding to be brought on by Hurricane Joaquin. Several of you came out to the warehouse to help us prepare equipment and check vehicles. All of you were diligent in responding to updates and requests from ServNC. This was also our first chance to really test the tools and information page and secure page of the website. Even after it looked like North Carolina had dodged the bullet, many of you waited patiently on standby as we anticipated needing to help South Carolina with either responders or by receiving patients from hospitals they were considering evacuating. Volunteers also played a huge role in the completion of our regional exercise series. In September, October, November, and December, volunteers helped on 6 different exercise dates. This help included working as exercise evaluators, simulation center support, acting as EMS delivering patients to the emergency department, and even as safety officers for an assisted living that wanted to test its evacuation process. Without your extra hands, eyes, support, and ideas, we could not have pulled off these exercises. In previous years, our primary source of engagement for our volunteers had been education and training. In 2015, education and training didn't take a back seat to working in the warehouse or participating in events. Instead, we continued to grow our partnership with Central Piedmont Community College as we offered Con Ed hours during our monthly meetings, offered regular sessions of the online initial training course, hosted hands-on training days, and as mentioned previously, produced an online training for the Flu On-Call program. We can easily say we have an educational program built to support our team's needs that will continue to grow and serve as an example for other teams and regions. So with all of these meetings, discussions, trainings, and events, you, the volunteers of the Metrolina SMAT, made an incredible contribution to the Metrolina Healthcare Preparedness Coalition. Each year, the coalition is asked to keep track of things like the number of hours that volunteers put in. This number is given a dollar figure and considered an in-kind donation back to the grant that supports our program. What does this mean? Well, for the calendar year 2015, you put in 1,142 hours of your personal time for the betterment of the team and region. That is over double the hours for the 2014 calendar year. For the current fiscal year, starting last July, you have already put in 428 hours. That is worth over $9,000 of in-kind support back to the grant. And we have a very busy spring planned that will put us well over the 1,100 hour mark, which would basically count as half of the in-kind match we need for the fiscal year. So I'll say it again, your time matters to this program. Last year, we called you family. This year, we will again reiterate that you are more than just volunteers to us. You truly are family, and we thank you from the bottom of our hearts for all that you do for us on a daily basis.